Most people think a light snack before bed is harmless. I watched a 68-year-old woman code at 2 a.m. because of what she ate 4 hours earlier. Her daughter was screaming in the hallway. The crash cart was already moving. And when we got her back, she looked at me with those confused eyes and said, "But it was just a small bowl." That moment changed how I talk to every patient about nighttime eating. Because what you put in your mouth before sleep doesn't just affect your digestion. It directly alters how your heart functions during the most vulnerable hours of the night. And after 3 decades in cardiac surgery, I can tell you this. The gap between what seniors are told about bedtime snacks and what actually happens inside the chest cavity at 3 a.m. is wider than you think. Here's what I'm going to show you today. 5 specific foods that millions of people over 60 eat before bed, believing they're safe or even healthy, that are quietly setting the stage for nighttime cardiac events. And more importantly, what you should eat instead if hunger strikes after 8 p.m. I'm Dr. Marcus Webb, a cardiothoracic surgeon with 28 years of operating room experience and over 2,100 open-heart surgeries. I've held beating hearts in my hands, felt them struggle, and seen exactly what happens when the wrong fuel meets a tired cardiovascular system at night. Most of what I'm about to share isn't covered in discharge instructions. It's not printed on hospital pamphlets. It's the conversation I have in the hallway with families after surgery, when the formal consult is over and someone finally asks, "But doctor, what really caused this?" The medical system is excellent at treating heart attacks. It's terrible at preventing the small decisions that lead to them. So I started tracking patterns. I started asking every patient over 60 who came through my operating room the same question: "What did you eat the night before?" The answers were shockingly consistent, and they pointed to 5 foods that kept appearing again and again in the 12 hours before a cardiac event. Your heart after 60 operates under different rules than it did at 40. Think of it like this. A young heart is a 4-lane highway with perfect traffic flow. An aging heart is the same highway, but now 2 lanes are under construction, the signals are delayed, and every vehicle is carrying a heavier load. Your cardiac muscle has less flex. Your electrical system has more interruptions. Your blood vessels have decades of micro damage. And at night, when you lie flat, everything changes. Gravity stops helping your circulation. Blood redistributes. Your heart rate drops, but your workload doesn't. One study from the Journal of Clinical Sleep Medicine found that adults over 65 experience a 40% increase in arrhythmia events between midnight and 6 a.m. compared to daytime hours. That's not random. That's your body in a vulnerable state. And what you eat in the 3 to 4 hours before bed determines whether your heart glides through the night or fights through it. Let's start with the first food, and it's going to surprise you because it's marketed as healthy. Yogurt. Specifically, flavored yogurt or Greek yogurt eaten within 3 hours of lying down. Stay with me on this. Yogurt itself isn't the villain. But here's the mechanism most people miss. Yogurt is high in calcium and often contains added sugars or fruit that spike insulin. When you eat it late, you're sending 2 conflicting signals to your cardiovascular system right before sleep. Calcium tightens smooth muscle and blood vessel walls. That's basic physiology. Insulin triggers sodium retention, which raises blood pressure. And if you're over 60, your kidneys are slower to balance this out overnight. The result? Elevated vascular resistance while you're flat on your back, exactly when your heart is trying to coast. I had a patient named Ronald, 71, who ate a small bowl of honey-flavored Greek yogurt every night at 9 p.m. because his wife told him it was good for his bones. He came into my ER at 1:30 a.m. with crushing chest pain, no blockage, no clot, just severe vasospasm triggered by calcium-induced constriction combined with a blood pressure spike. After we ruled out an infarction, I asked him about his routine. He'd been eating that yogurt for 8 months. We stopped it. Switched him to a magnesium-rich snack if he needed something before bed. He hasn't had another episode in 3 years. Write that down. If you want yogurt, eat it in the morning or early afternoon. If you're hungry at night, a small handful of almonds or walnuts gives you protein without the calcium surge. Your heart will thank you by not waking you up at 2 a.m. Second item, deli meat. Turkey slices, ham, salami, anything processed and sliced that you grab from the fridge for a quick bedtime bite. Here's what nobody tells you about processed meat after dark. It's loaded with sodium and nitrates, and both of those compounds behave very differently in your body when you're horizontal. Sodium doesn't just raise blood pressure. It thickens your blood slightly by pulling water into your vascular system. Nitrates convert to nitric oxide, which normally relaxes blood vessels, but in an aged cardiovascular system that's already struggling with plaque and stiffness, the rebound effect can cause what we call vascular whiplash. Your vessels dilate, then constrict erratically. That creates turbulence in blood flow. Turbulence creates shear stress. Shear stress destabilizes existing plaques. And a destabilized plaque at 3 a.m., when your clotting factors are naturally elevated, is a setup for disaster. I've seen this pattern too many times. A senior eats 2 or 3 slices of deli turkey at 10 p.m. because it feels light and healthy. By 4 a.m., they're in ventricular tachycardia or experiencing a TIA. The nitrate load combined with the sodium spike creates a perfect storm in an aging heart. One patient, Margaret, 66, had a small stroke. No major risk factors, no diabetes, controlled cholesterol. We couldn't figure it out until I asked about her nighttime routine. Every single night, she ate a roll-up of turkey and cheese before bed. She thought she was being smart by avoiding sweets. But that nitrate-sodium combo was lighting up her endothelial cells like a fireworks show. Have you ever eaten deli meat before bed and woken up thirsty or with a headache? Drop a comment below and tell me what you noticed. That thirst isn't random. It's your body screaming for water to dilute the sodium bomb you just dropped into your bloodstream. Here's the fix. If you need protein at night, choose fresh cooked chicken breast, a boiled egg, or a small piece of grilled fish. No processing, no nitrates, no sodium overload. Starting tonight, leave the deli meat for lunch. Now we're at the halfway point, and I need to tell you something. The next item on this list is sitting in your pantry right now. You probably think it's harmless. You might even think it's heart healthy because the label says so. But what I've seen in the operating room tells a completely different story. And when I explain the mechanism in the next 60 seconds, you're going to understand why this food has been linked to more nighttime cardiac events in my patient population than almost anything else. Don't skip ahead. This one could save your life. Third item, whole grain crackers or multigrain chips. I know, you've been told whole grains are good for your heart. And they are, during the day, when your metabolism is active. But here's the truth about grain-based snacks before bed that the food industry doesn't want you thinking about. Whole grains are complex carbohydrates, and they require significant insulin release to process. When you eat them at night, your pancreas has to work during hours. It's supposed to be resting. That insulin surge triggers a cascade. Your liver starts pumping out triglycerides, your blood thickens slightly, and your sympathetic nervous system gets a wake-up call it doesn't need. For a heart over 60, this is metabolic chaos, right before the most fragile part of your circadian rhythm. But there's a second problem most people never consider. Whole grain products are often high in phytic acid, which binds to magnesium and zinc in your digestive tract. Magnesium is your heart's natural rhythm stabilizer. It keeps electrical signals smooth. When you block magnesium absorption right before bed, you're setting up your heart for arrhythmia risk in the early morning hours, when sudden cardiac events peak. I had a patient named Dennis, 74, who loved his nighttime routine, a small plate of whole grain crackers with hummus at 9:30 p.m., then bed by 10. He thought he was doing everything right, low fat, high fiber. Doctor approved, or so he believed. He woke up at 3 a.m. 3 times in 1 month, with heart palpitations so severe he thought he was having a heart attack. Each time we ran tests. Each time, nothing conclusive. Until I asked him to stop the crackers for 2 weeks. Palpitations gone. Completely. The grain-induced insulin response combined with magnesium binding was creating just enough electrical instability to trigger ectopic beats during deep sleep. It is never too late to change a pattern, even one you've had for years. Here's what you do instead. If you want something crunchy at night, try cucumber slices, celery sticks, or a small handful of pumpkin seeds. You get the satisfaction without the metabolic storm. Your heart has been working for you every single minute since before you were born. Don't make its hardest shift even harder with the wrong fuel. Fourth item, citrus fruit. Oranges, grapefruits, tangerines, especially grapefruit juice before bed. This one shocks people because fruit feels innocent. But citrus is highly acidic, and acid reflux in seniors isn't just uncomfortable. It's dangerous for your heart. When you lie flat after eating citrus, stomach acid can push up into your esophagus. That's textbook reflux. But here's what most people don't realize. The vagus nerve, which controls your heart rate, runs right alongside your esophagus. When acid irritates the esophageal lining, it can trigger what's called a vagal response. Your heart rate drops suddenly. Your blood pressure dips. And in an aging cardiovascular system that's already borderline compensating, that sudden drop can lead to syncope, dangerous arrhythmias, or even a cardiac event that looks like a heart attack but is actually a nerve-mediated crisis. I've seen patients come into the ER with chest pain, shortness of breath, and a racing heart, convinced they're having an infarction. We run the tests. No blockage, no enzyme elevation, just severe acid reflux triggering a vagal episode that mimicked every symptom of a heart attack. And when I ask what they ate, 9 times out of 10, it's citrus within 2 hours of lying down. One patient, Linda, 69, drank half a glass of grapefruit juice every night because she read it was good for cholesterol. She ended up in my office after her 3rd ER visit in 2 months. We stopped the juice. We added a small dose of magnesium before bed. She hasn't had another episode. That question has stayed with me. How many people are being treated for heart conditions when the real problem is a glass of orange juice at 9 p.m.? If you love citrus, eat it in the morning. If you need something before bed, try a few slices of apple or a small banana. Low acid, gentle on the vagus nerve. Your heart will stay in rhythm and you'll actually sleep instead of waking up with your chest on fire. Fifth and final item, dark chocolate. I know this one hurts. Dark chocolate is everywhere in the wellness world. Antioxidants, flavonoids, heart healthy, right? Not at night. Not for a heart over 60. Here's the mechanism. Dark chocolate contains caffeine and theobromine. Both are stimulants. Theobromine has a half-life of about 7 hours, which means if you eat dark chocolate at 9 p.m., half of that stimulant is still circulating in your bloodstream at 4 a.m. Caffeine and theobromine both increase heart rate and can trigger premature ventricular contractions, especially in people with any degree of existing cardiac irritability. But there's a second issue. Dark chocolate is high in fat, and fat takes longer to digest. When you lie down with a belly full of slow-digesting fat, you're diverting blood flow to your digestive system during hours when your heart needs that blood flow for basic circulation. The result? Your heart works harder. Your oxygen demand goes up. And if you have any coronary artery narrowing, even mild, you're increasing your risk of ischemia during sleep. I had a patient, Edward, 72, who ate 2 squares of 85% dark chocolate every night after dinner. He thought he was protecting his heart. Instead, he was triggering runs of PVCs that woke him up gasping 3 or 4 times a week. He thought it was sleep apnea. It wasn't. It was theobromine-induced cardiac irritability. We stopped the chocolate, switched him to a small handful of blueberries if he wanted something sweet at night. The PVCs stopped within a week. If you want dark chocolate, have it in the morning or early afternoon. If you need a nighttime treat, try a few frozen grapes or a small piece of melon. You get the sweetness without the stimulant load or the fat burden. Starting tonight, give your heart a fighting chance. I need to tell you something I don't talk about often. I've stood in operating rooms at 3 a.m. with a patient's chest open, hands inside their rib cage, trying to restart a heart that stopped because of a decision made 12 hours earlier. And in the waiting room, there's a spouse or a child who's been sitting there for 6 hours, terrified, praying, bargaining with God. When it's over, when the patient is stable and I walk out to talk to the family, they always ask the same question. Why did this happen? And the honest answer, the one I don't always say out loud, is this. It didn't have to. Most of the cardiac events I see in patients over 60 aren't caused by some unavoidable genetic fate. They're caused by small, repeated patterns that nobody warned them about. A bowl of yogurt, a few slices of turkey, a handful of crackers, a glass of grapefruit juice, 2 squares of chocolate. Ordinary things. Things people were told were healthy. Things that, during the day, might be fine. But at night, in an aging body, in a tired heart, they become triggers. And the tragedy is that the information exists. The research is published. The mechanisms are understood. But it never makes it from the journal to the kitchen table. It stays locked in medical libraries and conference rooms, while people keep eating the same 5 foods before bed, night after night, until one night their heart says, I can't do this anymore. Let me tell you about the woman I mentioned at the beginning. Her name was Patricia. She was 68. No history of heart disease. Normal cholesterol. She walked 3 miles a day. But every night at 9 p.m., she ate a small bowl of strawberry yogurt and a few whole grain crackers because her daughter, who was a nurse, told her it was a healthy bedtime snack. The night she coded, she'd eaten that exact combination 4 hours earlier. We got her back. We stabilized her. And when she was awake and clear, I sat down next to her bed and explained what I'm explaining to you now. She cried, not because she was scared, but because she was angry. She said, why didn't anyone tell me this before? I didn't have a good answer. 3 months later, she came to my office for a follow-up. She'd lost 12 pounds. Her blood pressure had dropped from 145/90 to 128/78. She'd reduced from 4 medications to 2. And she said something I'll never forget. I changed what I ate before bed. That's it. That's the only thing I changed. And I feel 10 years younger. She sent me a card last Christmas. She's still walking, still thriving, still telling everyone she knows about the 5 foods she stopped eating at night. Here's what you need to remember. 5 foods to eliminate before bed if you're over 60. Number 1, yogurt, especially flavored or Greek varieties within 3 hours of sleep. Number 2, deli meat or any processed meat products. Number 3, whole grain crackers, chips, or bread. Number 4, citrus fruit or citrus juice. Number 5, dark chocolate. And here's what you can eat instead if hunger hits after 8 p.m. A small handful of raw almonds or walnuts, a boiled egg, fresh cucumber or celery, a few slices of apple, a small piece of cooked chicken breast, or a handful of blueberries. Keep it simple. Keep it light. Keep it heart safe. Now I want to hear from you. Which of these 5 foods have you been eating before bed? Drop a comment below and tell me which one surprised you most. If this information helped you or could help someone you love, share this video with them right now. And if you want more truth about what really protects your heart after 60, the kind of information that doesn't make it into mainstream advice, hit that subscribe button. I post new videos every week based on what I see in the operating room and what I wish every patient knew before they ended up on my table. One last thing, and this is important. I'm a surgeon, not your personal doctor. Everything I've shared today is based on my clinical experience and current medical research, but it's educational, not a replacement for individualized medical advice. If you have specific heart conditions, if you're on medications, or if you're unsure about changing your diet, talk to your physician first. I'm here to give you information the system doesn't prioritize. What you do with that information should always involve the person who knows your full medical history. But I'll tell you this, your heart doesn't stop working at night. It doesn't get a break. It doesn't pause while you sleep. It keeps beating, keeps pumping, keeps fighting for you every single second. And the least you can do, the very least, is not make that fight harder with the wrong foods at the wrong time. It is never too late to start protecting the organ that's been protecting you since your first breath.